Let food be thy medicine, and medicine be thy food. One of the greatest quote, the greatest wealth is health. Well, this brings us to our topic, and let me introduce our guest at our studios. It is our program, Meet Your Doctor, and I'm your host, DrBonnieMNicol. With me is Dr. Ritu Rai, a very experienced clinical dietitian of Nazareth Hospital. Welcome to our studios, Doctor.
Thank you so much, Dr. Bonnie.
Well, I'm sure our listeners will really benefit with your expertise, and they will have their queries to ask after a while. So in today's fast-paced world where diseases seems to lurk around every corner because of all the pollution, so maintaining optimal health has become a top priority for many. And it is, of course, the powerful tool on our plates. So, Doctor, at the very outset, what is the role of nutrition in preventing diseases and, of course, the strategies for a healthier lifestyle?
Well, thank you so much, Dr. Bonnie, for the question. Yes, going back to the question, definitely you can say that nutrition is the core of our very being, because that is the only source of nourishment that we actually have for not just, as you said, maintaining, but building and prevention, and also for curing of many kind of health related issues, or even preventing many kind of micronutrient deficiencies which may have a role in shaping diseases in the later run. So definitely nutrition is a key role, and the knowledge of not just eating right, what we call as optimum nutrition, balanced diet or mindful eating is important, but also knowledge of the right cooking, the cooking techniques, or what are the best ways by which we can preserve nutrients, and even kind of selection that will be very important in going about implementing good nutrition.
Right. So, Dr. Ritu, the power of nutrition, in fact, it's all about understanding the importance of essential nutrients. Could you tell us a little more about the essential nutrients?
Yes, Dr. Bonnie. We all know that food is a composite of many nutrients. So we do have many nutrients like what we call the macronutrients, which give us major building materials, protective materials like the proteins, the carbs, the fats, which also supply energy, and they have various important functions. And besides that, we also have the vitamins and the minerals and the dietary fibers. Each of all have important functions in preventing, in promoting, in even restoration, and they play a big role, in fact, in even healing process, as we spoke about the vitamins, like we have the vitamin C, the vitamin A, the B vitamins, and the immunonutrients and all that. So all of these nutrients, they have an important role in health and disease, so as to say, so which we shall be discussing, as we progress with the program.
Right. So what are the diseases that are related directly to nutrition?
So as to say, in every scenario, nutrition will be important, So even if a person is, afflicted or down with fever also, definitely nutrient requirements will change. There will be dietary modifications. So needless to speak, Dr. Bonnie, about the, things that are happening now, the degenerative diseases, like you have your major concerns like diabetes, we have the cardiovascular diseases, we also have, the more, severe forms of cancer, so as to say, and hypertension, dyslipidemia. So these are really major issues, where nutrition plays a very important role, especially when a person is, undertaking treatments and all that. So like we've already spoken about, especially in very chronic conditions, So it so happens that whenever a person has to start the treatment, well, there will be some kind of setbacks in the, immune response process and all that. So not just in terms of an energy we have to see, in that aspect, but also in terms of restoration, in terms of the rehabilitative, in terms of even, withstanding the treatment so that the healing becomes quicker. And especially in hospitalized patients, you can say the length of the stay decreases and the patient can go home quickly. So nutrition plays a very, very important role in these kind of setups.
Well, listeners can also call us up after some time, and Dr. Ritu will be answering your queries. Any questions related to nutrition and health, she's here to clear your doubts and to make you all understand all about the importance of nutrition. Well, Dr. Ritu, there are some very new emerging diseases. So what is the role of nutrition, in combating those emerging new diseases?
Like I've said, what happens is that in most of the diseases, especially when the treatment process starts, so, it has been seen that patients have to, undergo a lot of stress, especially when it comes in the physical, physically they have to go through a lot of stress and trauma and all that. So what we see most often is the malnutrition process starts setting it very quickly. So to prevent the process of malnutrition, which could be a major setback in the patient's recovery process, good nutrition will be very important. So for that, a proper nutrition assessment and maybe a screening can be done, and as per the patient's requirements, his food habits, and what are his requirements at the moment, a proper diet plan with maybe extra supplementation can be given so that the process of malnutrition can be minimized. And you can say the deficiencies which show up very early, sometimes when the treatment is quite harsh, the medical treatment, so as to say. So these risks can be minimized, and as far as possible, nutrition will be a very important therapy in these situations in, getting the person recover quickly, so as to say. So even in certain situations like diabetes and all that we see. So yes, nutrition not only helps in, you can say maintaining or, trying to get back the parameters under control, what we call the biochemical parameters. But one aspect of every disease, like I've already spoken, is what we see in the hospital is the malnutrition process. So those risks are to be minimized.
All right, I think we have our very first caller. Hello.
Hello.
Hello, may I know who's speaking?
Good afternoon, Bonnie.
Good afternoon, and may I know who's speaking?
I'm Sakosem Roma from Imphal, Manipur.
Oh, okay. Hi, good afternoon. So we have Dr. Ritu Rai with us. She is a clinical dietitian.
Hi, good afternoon.
So please go ahead with your question.
Yes, thank you. Doctor, I have been listening the program since the very start.
Okay.
And for the right topic that we have taken up for the program, one question particularly I was about to ask you is, in the present scenario, cancer seems to be a very common disease that has affected almost every household in India.
Yes.
So I was just about thinking, is the wrong food choices the culprit for this new development, or what can dietary food choices, help in preventing such a disease? A very, this is kind of a very risky and scary disease that nobody wants to talk about.
Yes, true. Yes, that's a very good question which you've put up. Yes, definitely. But then there is always hope, so we should not lose heart. There's a good recovery, a chance for these patients if, nutrition and the treatment goes hand in hand. Yes, like you have spoken about, what we see is that these problems, the onset starts very early, So definitely faulty eating habits, making not the right food choices, and then, not even going in for a balanced diet. And then when, the deficiencies at the early stages, when they're neglected, for example, there are issues like acidity, hyperacidity, all these things, when they are not controlled at a very early age, they may manifest, later ways, along with other factors what we see. So most often now, we all know that we are living in a, environment of radiation. We are living in an environment of, all processed foods, and we are living in an environment of additives, so as to say, like artificial preservatives and all that. So it is very important to educate people about the right way of cooking and how to choose foods from nature, which people are not doing because of, maybe you can say, the pressures of work, and because of it has become very hectic, So what I have observed is that, like I said, there is an imbalance definitely, and we are not going for nature, we are going for quick convenience foods, which could be a setback. Yes, we're going for packet foods, processed foods, tin foods, packaged foods. So, and people are not going much into cooking, cooking. So already I had spoken about the different, earlier times people would cook foods, So now that thing has come down because of the, work schedule and all that.
Yeah.
So definitely see, nature has gifted us with antioxidants. We have different colors. We have purple colors. We have, the pumpkins. We have the orange colors. We have the red. We have, you just look at the nature, you just look at seasonal availability of whatever is there in our markets, We have the seeds, we have all these, the greens and all that. So I feel if we can avail, the stuffs that are there in nature, and, go in for, colorful stuffs, and we go for the antioxidants, go for cooked foods.
All right, very interesting question that I have here, Dr. Ritu. Many of us, we have a sweet tooth, we call it, or sweet teeth for that matter. So what are some ways, to curb sugar cravings?
Well, that's also a very good question, Dr. Bonnie. Yes, definitely. Like we just spoke about nature. Nature has given bountifuls, we do have substitutes for synthetic sugar or sucrose, so as to say, which will not be too good for health, because overconsumption of calories will, as it's known, that is also a very important causative factor for obesity, which itself is a risk factor for many diseases. So looking at the substitutes, we have food items like dates, and we have natural food items like figs, or even, you have these, pure honeys. You have even, so as to say, you have these fresh fruits which are little sweetened by nature, like, you have mangoes, we can, you have like lychees and all that, which of course comes during a seasonal, like there is a time for it. So I feel like if we can substitute those kind of foods with synthetic sugar, so as to say with sweets and all that, which are loaded with a lot of colors, artificial colors, and they have a lot of trans fats, so which will not be very good in the long run. And like I said, if we can promote, healthy food items. I see a lot of, in fact, cookery shows and all that, where they're promoting a lot of good stuffs, like making halwas, and then making laddus, biotin laddus from seeds and nuts and all that. I think
jaggery
also,
good.
Yes, jaggery. You have good quality jaggery from dates and all that. So I think that should also, curb the sweet tooth, instead of just going for the trans fats loaded sweets, so as to say.
All right. So, Dr. Ritu, while we are waiting for our next caller, having had more than 20 years of experience, as I understand, as a clinical dietitian at Nazareth Hospital, what has been your experience overall?
Nutrition field, what we have observed, yes, definitely, like I've said, people are always on the rush. So there should be mindful eating, which people are not really going into. everything is there in nature, but we are not going for that, We don't have the eye and the mind, or rather I should say more the mind, because people are always stressed and running after things, and, they don't really, that's been my observation. So I think we should stop a while and look around, and then try to inculcate cooking skills and all that, so that we can make avail what has been gifted to us, and make use of everything, incorporate more of a balance in our lives, balanced diet, and do a little of chewing and eating, and not just rush into things and all that. And like I've already spoken about, limit your intake of all kind of processed foods and preserved foods, as no doubt they're convenient, they make things easy, but then I think as for food and nutrition is concerned, we should not take the easy way out, so that is the only source of nourishment. It's like nurturing a plant. So if you need to nurture your body, definitely we have to make avail of what is there, and try and incorporate those skills, so as to say, like even in the hospital, what we see is that if a person is sick, so it's very easy for them to pick up a kind of processed fruit, like juice or something like that. So they don't really give too much of mind that the juice is actually it's devoid of fiber, or it may not really have those kind of nutrition Natural. What you're looking into. So it's important to promote. And yes, definitely adulterance also is a big problem in days of today. So a little of proper cooking methods, education, and educating the family, and bringing more awareness into their lives, So what we call as not just holistic kind of an approach, where not just nutrition, but your mind, your everything is into play, just to coordinate up everything, just to have a better health outcome.
Beautifully said. And if I'm not wrong, I think we always tell our children also, that you should see what you're eating, because sometimes, some parents give the mobile phones, and they're so hooked onto the mobile phones, true, and they don't see what they're eating, Yeah, so I think they should really see and, feel the I would use the word feel the nourishment, not just eat.
Yes,
you got to feel, yes.
Definitely, because the message has to go to the brain itself, So it shouldn't be just rushed up eating, more mindful eating, and creating a balance, creating more of cookery in your, plate, rather than going for convenience foods. That's my observation. And yes, making use of seasonal foods, like for example, now we have a lot of gooseberry amla, but I hardly see people eating that, but very few know that just taking 5 in a day would actually fulfill all your requirements of vitamin C. You don't need to really pop in a pill kind of,
All right, another query just popped in, and it says, what kind of nutrition should be considered in case of 24 intermittent fasting? Well, I almost had that question coming up next, because nowadays people are into this intermittent fasting. So what is your say on this?
To be honest, Dr. Bonnie, intermittent fasting needs a lot of magnification, before a person starts. The person should actually be screened, especially if the person is having issues, relating to the GI tract. So they should be a little careful, because it involves long hours, long periods of not eating, And second point, what I want to say is that most of the people, when they, break the, the tenor, the time period, when it's very, very long, and when they actually start with the plate, that plate is not very balanced, so as to say, So you need to bring into, because you could be losing meals, and losing meals means you could be losing vital nutrients. One meal also could mean a loss of so many vital nutrients. And if a person is suffering from issues like gastritis or ulcer, that would not be a real, good thing to do, intelligent thing to do. So first of all, get your facts checked from a doctor, and then, what you put on the plate, after you actually fast and bring up to yourself, that should be a very balanced plate, so that you can actually make up for all the losses that you've had, and along with supplementation of vitamins, minerals, so that you don't go into deficiencies. These are the things that people need to look into. So I think intermittent fasting should be monitored, it should not be just started by a person on his own, like whims and fancies, because there could be disastrous effects.
And sometimes it's just a trend.
Yes. They should not follow trends blindly. Yes. So it's very important to come to healthcare professionals, get yourself screened and get the knowledge, and then see what your body type is, how you're responding to it, and just get a blood test done. Just check your vital parameters, check whether all your profile is fine, like your blood sugar or your cholesterol levels and everything, your liver function test. And then maybe you can do up with the plating as guided by a professional, maybe nutritionist or a doctor.
Well, we've spoken so much about the role of nutrition in combating diseases as well as preventing some diseases. And I think some of our callers are trying to call us up, but not getting through the line. But I think this is a query that is there in everyone's mind. So, Dr. Ritu, while we still have you here with us in our studios, I think we should take the benefit of asking you to, design a tailor-made a balanced diet for us, for a normal, healthy person. What would be a tailor-made balanced diet? Starting right from breakfast, maybe.
Okay. So, actually, the thing is that, yes, we do have different plannings for different age groups as per requirements. But in general, so as to speak, I would really focus on one nutrient which is of most importance, that is fiber, cellulose, which we get from as much natural foods as less processed food items. So for me, chapatis would be a good choice instead of going for breads and all that, which are full of trans fats like we spoke of, or they are loaded with a lot of additives like baking soda, which may not be good for hypertension. So you can just go for a different kind of what we have nowadays. We have very coarse grains, like we have the ragis, you have the bajras, you have the millets. So they are loaded with dietary fiber, and it has been seen that in nutrition, fiber has got a lot of health benefits. We have already spoken about, the dreaded diseases and all that. So they have a lot of, positive role in prevention of different kind of, like, especially for these intestinal problems and all that, So if you choose these coarser grains, we have the grams which are loaded in the market. You have the soyas, you have all the different kind of pulses. Why not avail them, Mm-hmm. And yes, definitely for calcium, you need good sunlight. If you can take some kind of milk products which are maybe from a good source like milk and all that, or homemade paneers, that's fine. And fruits, I should say, you should just don't just look at avocados and costly fruits like apple. Just look into the, like what is given by the local, market. Like we have the amlas, we have the gooseberries, we have the berries, in fact, which are loaded with antioxidants. We have lemon. Why don't we use lemon, which is a very good source of vitamin C? Mm-hmm. You don't need to go for like imported fruits and all that. And vegetables, I should say that our place is blessed with all these indigenous vegetables.
Organic.
Yes,
mm-hmm.
Especially we have this banana flower, the stem, that is a very good source of zinc, which is supposed to be a good antioxidant and a very good immune, like a booster kind of, so especially in diseases as diabetes and all that, cholesterol and all that, it has been shown to have very good beneficial, effects. And apart from that, like I said, you maintain your timings, just be slow about, like, go for mindful eating, limit salt, don't go much for packet foods and all that, as they have a lot of class 2 preservatives. Don't go much for like other kind of preserved bottle canned stuffs. Just go like as much as for cooked foods. That's the only message I can give.
What are the best sources of plant-based proteins?
Yes, that's also a good question, Dr. Bonnie.
Especially for the vegetarians.
Yes, because plant-based proteins will give us the additional benefits of dietary fiber. And as I've already spoken, fiber has got immense benefits even in your weight management process and even for maintaining your blood lipid profile. And, like if there is maybe just a raised level of sugar in the blood, it helps to combat all these problems. So definitely pulses, legumes, and there is a, legume called soya bean, which makes up for all the essential, what we say, amino acids, and they can very well compete with fish, meat and all that. So I feel even egg. So soya bean, what they call as rimbai, so that should be kind of substituted. It should be like, incorporated in the diet on a regular basis. And we also have the nuts like almonds. You can always prepare almond milk out of almonds. So that will be a better substitute for cow's milk, in fact. But I mean to say all fresh, not the packet and the processed ones which you get from the market. And you have the dried fruits and all that. So they will easily substitute for the, vegetarians for the protein intake.
Well, of course. So besides the mean meals, what are some healthy snack options? Because, especially the youth, they're always after snacking. So very quickly, if you can just tell us.
Yes, good snacking would mean healthy eating also. Like I said, we spoke about nuts. You can go for nuts. You have this, there is in fact, a kind of a cereal which we call as makhana, which is very high in calcium. That is a good snack. And maybe some kind of beans, boiled, chanas and all that. They can, you can make it into chaats and all that. You have this Bengal gram, Kabuli chanas and all that. And you also have these roasted, chanas, which even peanuts and all that, which can be taken as good snacks instead of, snacking on pizzas and burgers, which are, full of trans fats and sauces and colors. Mm-hmm. Of course, if they can be prepared at home and be given a healthy twist, there's nothing much like it.
Right, Dr. Ritu, I'm already feeling hungry listening to all the, food items. But yes, that was the power of nutrition, fueling our body for optimal health. And all we need to do is embrace daily nutrition guidelines, as pointed out by Dr. Ritu, which is the key to unlocking a healthier body. And that brings us to the end of our program, Meet Your Doctor. I would like to especially thank Dr. Ritu Rai for being with us and sharing your expertise, answering the queries that our listeners had, and also some of the messages that were sent. I would also thank the listeners for being a part of this program. Thank you for listening. I'm sure it's all about healthy eating that keeps us healthy. To eat is a necessity, but to eat intelligently is an art. So eat right, balance your plate, nutrition first always. This is your host, DrBonnieMNicol, signing off. Thank you.